Good afternoon. I've got some info I told you about this morning. We're going to talk a little bit about the masks, wearing of the mask. You guys having a good day? It's afternoon where I'm at now. It's about 1:40. Just finished with patients for the morning. Had some virtual consultations over the Zoom, which has been awesome. But I want to talk to you all a little bit now about masks. Here's my disclaimer. I'm not giving you any medical advice. I'm not telling you what you should or shouldn't do. I'm simply going to show you what the research says, okay? That's what I'm going to show you, all right? You do whatever you want to do. If you feel more comfortable wearing a mask, do it. If you don't, that's your decision. Now, here's the other disclaimer. If, for whatever crazy reason, there's a law that says that you have to wear a mask, now, I'm telling you, if it's the law, then you got to abide by the law unless you want to get a fine. That's your decision. But I want to share with you what's going on, especially with these cloth face masks. I'm seeing people walking around with these bandanas around their face all the time, and I just want to make sure that everybody understands what the research says. So, hope everybody's doing good. Hello, everybody saying hi. I appreciate you guys all very much. Little dose of common sense here. Do me a favor and share this because I promise this one's probably going to get pulled as well. Whatever. So here we go. This is what the research shows on the mask. To wear a mask or not to wear a mask. This is the research. So the first one is effectiveness of masks and respirators against respiratory infections in healthcare workers. This is a systemic review, a meta-analysis. So they take a bunch of different peer-reviewed articles and they break them down, and PhDs look at them and they go, here's what's found. So here's the meta-analysis. The first one is out of a clinical journal called Clinical Infectious Diseases, December 1st, 2017. It says, our analysis confirms the effectiveness of medical masks and respirators against SARS. Disposable cotton or paper masks are not recommended. Let me just say that. That's out of the Clinical Infectious Disease Journal 2017. It says the analysis confirms that the effectiveness of medical masks and respirators against SARS, remember, SARS-CoV-2 is the official name of COVID-19. It says disposables, cotton, paper masks are not recommended. It also says in such cases, single-use medical masks are preferable to cloth masks, which there is no evidence of protection which might facilitate transmission of pathogens when used repeatedly without adequate sterilization. So now they're saying take your mask, you can reuse it, put it in the dryer. I mean, I get that there might be some new research coming out. I get it, okay? But this research says that there's no data that shows that using a mask more than once is efficacious. Now, I know that the government and CDC and all these other folks are recommending to have a mask and reuse it, and some of these organizations have high heat where they can kill any viruses in it. Some are using UV light to kill bacteria and virus on it. That's a different situation. What I'm talking about are people that don't have that, okay? And the research clearly says this. So please make sure you go back. I'll post this on this site. Please make sure you guys go back and then print this stuff off and you do your own research. I'm just sharing with you what the research says. You do whatever you want to do. Number 2, it says face masks for the prevention of infection in healthcare and community settings. This is the British Medical Journal, BMJ, 2015, says the use of reusable cloth masks is widespread globally, particularly in Asia, which is an important region of emerging infections, but there is no clinical research to confirm their use, and most policies offer no guidance on them. So I'm just trying to tell you what the British Medical Journal says in 2015 is that reusable cloth masks are widespread globally, especially in Asia, which is an important region for emerging infections, which is interesting, by the way. But there's no clinical research to inform their use and others' policies or guidance. So there's no research that shows that you should do it, at least with that. The next one is effectiveness of surgical and cotton mask blocking SARS-CoV-2, which is the official term for COVID-19. This is out of effectiveness of surgical and cotton mask blocking SARS-CoV-2 controlled comparison for patients. This is in the Internal Medicine Journal. This is published in 2020, April 6th of 2020, April 6th. So a lot newer research. Here's what it says. The discussion says neither surgical nor cotton masks effectively filter SARS-CoV-2 during coughs by infected patients. Prior evidence that surgical masks effectively filtered influenza viruses informed recommendations that patients with confirmed or suspected COVID-19 wear masks to prevent transmission. However, the size of the concentration of SARS-CoV-2 in aerosol, so like in the air when you sneeze or spit or whatnot, generated during coughing are unknown. So we just don't know the size of everything yet. Two researchers found they demonstrated that surgical masks did not exhibit adequate filtration performances against aerosols measuring between 0.9 and 2 nanometers in diameter. Okay, the researchers also showed that particles that are 0.04 to 0.02 nanometers can penetrate the surgical mask. So they're saying that those can penetrate it. All right, so I don't know. You do what you want to do. The size of the SARS-CoV-2 particles, the outbreak that was in 2002-2004 is estimated to be between 0.08 and 0.14 nanometers. So obviously those are, according to what this says, enough to escape a mask. Assuming that SARS-CoV-2 has similar size, surgical masks are unlikely to effectively filter the virus. I mean, that's in the Internal Medicine Journal, April 6, 2020. It's a peer-reviewed medical journal. I'm just telling you what the research says, okay? Number 4, masks for all, COVID-19 not based on sound data. That's the title of the article they looked up. This was April 2020 as well. It says this is a cloth mask as a source of control. Kellogg was the researcher that did this. What they found was that the number of cloth layers needed to achieve acceptable efficacy made people difficult to breathe. It was too thick. They had to put too many layers on, and it caused leakage around the outsides. Remember, the surgical mask, they have to be the right size for you, and they have to be fitted for your body. They have to be fitted for you. All right, and what do the masks do? They help you from touching your face, right? But they're not stopping the spread of you. If you wear it and you cough, if people want to wear a mask, wear one. If you're coughing and sputum and see, wear one. But if you're not symptomatic, the research says that it helps you from touching your face. That's it. It also says in the same study, in summary, given the information about their performance, they're talking about cloth masks, as a source control in real-world settings, along with extremely low efficacy of cloth masks as filters and their poor fit, there's no evidence to support the use by the public or healthcare workers to control the emission of particles for the wearer. So they're saying that it's not effective. Cloth mask is PPE, personal protection equipment. Random trial compared the effects of medical and cloth mask on healthcare workers. The illnesses found those wearing cloth masks were 13 times, let's say that again, those wearing the cloth mask were 13 times more likely to experience influenza-like illnesses than those wearing the medical mask. So the medical mask is obviously the way to go. In summary, very poor filter and fit performance of cloth masks, described earlier, we talked about that, and very low effectiveness of cloth masks in healthcare settings lead us to conclude that cloth masks offer no protection for healthcare workers inhaling infectious particles near or around an infected confirmed patient. So there's that. What else can I share with you here? Here's some things. This is another article that was looked at. This was in 2019. This was in January 2019. Advice on the use of masks the community during home care and in healthcare settings in context of novel coronavirus 2019 COVID-19 outbreak. It says, medical mask is not required as no evidence is available on its usefulness to protect non-sick persons. However, masks might be worn in some countries according to local cultural habits. If the masks are used, best practices should be followed in how to remove it, how to put it on, how to use proper hand hygiene, and disposal of the mask. Individuals with respiratory symptoms should wear a medical mask. I would agree with that. If you're coughing, spitting, sneezing, whatnot, I would agree that you should wear something. Most people don't sneeze into their elbow or their body. If you got a mask on, that could at least, if I'm within a couple feet of you and I cough and sneeze, I don't want to spit that on you. You don't want that on me. So I could see if you're sick wearing one, if you have symptoms, but I don't see, the research isn't supporting if you're not symptom-wise. And I understand what people are going to say. Well, you can be symptom-free and still be a carrier. Yeah, I agree. You can. We need to get exposed to this thing. Only way we're going to beat it. Let me see. There was something on here. Oh, yeah. Let me say this. Number 8. Masks may actually increase your coronavirus risk if worn improperly, Surgeon General warns. This is Dr. Jerome Adams. You guys have heard him come out and say multiple times. This was last month. This was in March of 2020. Surgeon General Adams says, quote, folks who don't know how to wear them properly tend to touch their face a lot and actually increase the spread of coronavirus, unquote. He also says this, quote, seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus. That's what the Surgeon General said. Now, I know there's a lot of politics out about this, but that's what the research shows. Same thing with gloves. If you want to wear gloves, that's fine, but you need to change your gloves every time you touch something, right? So just think about that. Thought that was interesting. Wanted to share that with you. This is a neat little, this was with that article, by the way. Some of you guys probably seen it. It's been all over social media. Whoever hasn't suppressed this information is still there. It talks about the N95 mask. That's the highest quality, best one. 95% protection against viruses, 100% for bacteria, 100% for pollen, 100% for dust. I think that's great, but it's got to fit right. That's the key. It's got to fit good. So it talks about surgical mask, 95 virus, bacteria is 80, dust is 80, pollen's 80, which, by the way, I don't know where in the world you guys are at, but mold, pollen, allergies are already high here in Missouri. The FFP1 mask, you guys see those? These are, you see these more than any. I see these more than anyone. It's got 95% virus, bacteria is 80, dust 80, pollen 80. It's pretty much like a surgical mask. But the activated carbon ones, no good. Cloth mask, 0% for viruses, 50% dust, 50% pollen, 50% mold. Sponge mask, the ones that are like, you see the ones where people have their like Louis Vuitton mask and all that stuff, the sponge ones. It's like 0 for viruses, like 0.5% for dust, 0.5 for bacteria, and 0.5 for pollen. So that's what the research says. But here's the deal, though. We don't like mask shame. I don't shame someone if they want to wear a mask. We have some patients that wear them in our practices, and that's fine. If the governor came out and said we have to wear a mask because it's a law, then we would have to seriously consider that. I mean, if they told us that we had to show up in a hazmat suit to treat people, and that was the only way we could do it, it's more important for me to be able to treat people than it is for me how I look. Now, I'll be angry about it. I don't like to be forced to do anything. That's again like forcing me. Forcing me to wear a mask is like forcing me to take a drug that I don't want to take, or forcing me to do a vaccine that I don't want to take, or forcing me to have a procedure that I don't want to have done. Like, this is a form of medical enforcement of mandating you to do something. You're losing your controls. And I don't know if you guys are okay with that, but I'm not okay with that. I'm not okay with the government telling me what to do, especially non-healthcare practitioners. You guys, we have a background in immunology, a background in microbiology, a background in all. I mean, this is what we're all trained the same way. Doctors, whether you're a chiropractor, you're an MD or DO, basic sciences are our foundation of everything. We all have the same education. Chiropractors, like myself, get a little bit more in physiology, a little bit more in pathophysiology, a little bit more in diagnosis. than most of the other doctors do. They do some of that in their advanced training, but they have more in pharmacology. That's why your doctors are all about take this drug, do this thing, because they're not educated on the nutrients. They're not educated on the natural stuff you can do. They're just not. And I know that because I've trained and worked with thousands of doctors across the country. It's just the truth. And then I just got to bring this up again, like how many of us are okay with this? How many of us are okay with doctors these are doctors that are informing our politicians on what decisions that we need to be making and doing. They're telling the governors and the local officials what should be done. This doctor in Illinois, this is J.B. Pisker's, I say his name wrong, but the governor of Illinois' doctor, and she says this is what she says. Everyone who is listed as a COVID death doesn't mean that was the cause of the death. Did you hear what that just said? But they had COVID at the time of death. It means technically, even if you died from a clear alternate cause, but you have COVID at the same time, it's still listed as a COVID death. Are you guys okay with that? I mean, listen, I truly believe, I know it's reversed, I'm sorry, but you understand what I'm saying. If wearing a mask is what you want to do it. There's no problem with that. I'm not going to mask shame you. I'm not going to glove shame you. I have no problem with that. But don't shame someone that's not. I can't tell you how many people have come up to me and said, I went to the store the other day. And by the way, we're not having mandated masks in Missouri for anything that I know of yet. But we had some people that said they went to the grocery store and they said, where's your mask at? And they're like, no, I don't need one. I'm good. I'm healthy. I'm fine. I'm fine. I'm not going to touch your face and touch mine. But I'm not going to shame anyone. But you guys don't need to be shaming anyone either. So just do yourself and do us all a favor. Everybody do your own due diligence. Do your own research. Look up stuff. Don't just take for granted what you're being told. All right? Look stuff up. Do some research. You guys, most of you are at home, don't have a lot going on anyway. It's a great time to check out the truth. The truth will set you free if you'll let it, but you got to be willing to put in the work. And if you want information on this, we've got our site set up. It's ericnepute.com. So just go to Eric Nepute. It's ERICNEPUTE.com. And we'll have this information will be on there. Some of you guys were on the call last night and we're asking about, recipes for fat bombs and how do you get kids to eat vegetables. We'll put that stuff on there. So it's going to be on ericnepute.com. That's our page. There's some info on there about all this. Whatever we can do to help you guys, I'll do. That's why we're here. So anyway, I just wanted to share that with you. I'll post later on. You guys share this with your friends and family or do a watch party or something so people can see what the research says. I mean, the politicians are telling you to do this. If they want to protect their business and it's the business decision, they've got the right to choose that. If the grocery store says, I'm not letting you in unless you wear a mask, I'm probably going to go to a different grocery store. But if that's the way they choose to do business, that's the way they choose to do business, and they can do that. But if they don't have those mandates, then it's really up to the individual. Don't you agree? Don't you agree it should be freedom to choose with your healthcare rights? The problem is that most people don't know the risk versus the benefits with most things, so they're not able to make an informed decision. So I just wanted to share that with you. Appreciate you guys. We got some great stuff coming up this afternoon, some really cool interviews. Go to commonsensehealth.com or go to Common Sense Health on Facebook. We got some great info there you guys can look at. But everything's being censored so bad. I had a lady today say that every time I try to comment on your post, I can't ever write on it, or the computer screen glitches, or or there's another problem. It's because we're being censored. Why, though? Why do the powers that be not want the meta-analysis of wearing masks out to the public? Why would that be? Why would people not want the information about how vitamin C helps with viruses? Why would they not want you to know the research that was done in 2006 and 2010 on SARS and other viruses in the relationship between zinc? Why would they not want you to know that? And why are your doctors not talking about that? Because they don't know. And what your doctors don't know can and will hurt you and can and will kill you and can and will keep us in a state of fear and panic. I'm not okay with that. So I'm all about trying to help people, inspire them, give them some facts and some faith. So, hey, listen, I love and appreciate you guys. It's almost 2 o'clock here. We got to get back to work seeing patients. I hope you guys got some benefit out of this. Please go back and rewatch this. Share this. Please share this with your people. And it's good. We're all going to get through this. We're going to get through this together. But I just need you guys, I need you all to kind of step back in life and go, if this doesn't make sense, you need to do a little bit of research on it. So do that. All right, have a great day. Appreciate y'all. I'll be back later on. Talk to you guys soon. Bye.